Some bad news for Obamacare. The insurance company Aetna is pulling out of the majority of the Obamacare exchanges that it operates in. United Health and Humana recently announced that they would do the same thing. The carriers say they're losing money because too many sick people are signing up and not enough healthy people are enrolling. And here in New York State, individuals in the Obamacare exchanges are looking at a 17% rate hike, and companies will be smacked with 8% increases. But the news isn't all bad. The percentage of uninsured Americans has fallen to record lows since the law kicked in back in 2010. 20 million people who weren't covered then are covered now. Also, government numbers show that healthcare spending actually grew at the slowest rate on record last year, and that's due largely to Obamacare. So, Shelley, we have all of these positive signs that the rate increase has slowed and we have more people, fewer people who are uninsured. But at the same time, everybody's seeing a big spike in their premiums, and now you've got some insurance companies running for the hills. Is it Obamacare a success, a failure, or is it too soon to really give it a grade at this point?
Oh, I think it's definitely a success. It has serious challenges, but I think you should separate these issues. The decision by certain insurers to pull out of the market is frequently motivated by other things other than their loss. Don't forget they're privately controlled, they have shareholders, they have a fiduciary interest in making as much money as possible. So if they see they're going to lose or not make as much, which I think is the case of Aetna, they're free to pull out and hurt people in the process. The real story about Aetna is in part that the Obama administration rejected their merger with Humana and that they were mad about it, and it doesn't let them make as much money as they would like, so they're pulling out sort of in retribution against it. So I think you have to separate the issues. The hike in premiums is a very serious issue we have to address, but the fact is overall we are bringing people into health insurance coverage.
See, I disagree. I think it's largely a failure in some respects. It's not the people who now have insurance. It's the people who can't afford the increases that this is across the country, up to 30% increase in the premiums, and they've had to drop out. So the people, many people who benefited from Obamacare are now no longer able to get it. And it's driven by money. It simply is not. So it needs to be changed and tweaked. I don't think it ever can be thrown out, but it needs to be changed, in my view, anyway.
That's my next question. What do you do with it? Do you tweak it? Do you move it closer to single payer? Or do you repeal and replace, as we've heard so often?
Well, to repeal it, I think it's too entrenched now. You don't want to kick people off of having insurance, but you got to go in there and make it financially viable for the companies, which means it has to be a set of new standards, it seems to me. The way it was written, and I don't know if you agree with this, Shelley, but the way it was written was a hodgepodge of stuff that was thrown in there, not by the Obama administration, oddly enough, but by all the legislators who threw different pieces in it. So you got a Goldberg-like operation that really needs to be changed.
With a lot of goodies in there for the insurance companies, because they didn't want to kick the insurance companies out of the process. But what would you do with it?
And that's how they got it done politically, in part, was by having the insurance companies buy in and be at the table. Well, I think, Hillary has an interesting proposal about making Medicare more accessible at a younger age. I think Medicare is a good example of a government payer. Most people are very satisfied with Medicare coverage. Nothing is perfect, but they like it. Medicare, expanding that, and government payers generally has proven to be a better way to manage costs.
Dominic, just from the headlines, you would think this is sitting on a tee for the Republicans, but it really hasn't been that much of a campaign issue. Is that because there's no good option for them, or is that because they've gone to the repeal and replace well so often and nobody seems to have come up with any way to actually replace it?
How many times has Congress tried to repeal
54
this?
54 or something like that?
54 times. They've been unsuccessful every single time. I've watched candidates all across the country when they go with the stump speech, and when I'm talking pre-Obamacare, when there were devastating stories, often from mothers with children, how they couldn't, some catastrophic health issue, they couldn't get insurance and so on, and it just broke your heart. I mean, it broke your heart to listen to these stories. And so first Hillary Clinton tries, she's unsuccessful, then Obama comes, he gets it done, he goes down in history. So that's the good news. But the bad news, just about everybody I talk to, they say their premiums are going through the roof and that they can't afford it. So the great news is you insured, what, 8 million people, 8 million people that were uneligible in the past for health care insurance. But if the premiums are going through the roof, and here's the bottom line, Andrew. if it's not being manipulated, the marketplace often determines whether or not something is successful or it's not. And right now, I'm aware what the Assemblywoman said, that, you know, some of these health care companies are greedy and they want more profit than what they're actually making. But Aetna is talking about actually losing money now. So if the marketplace is leaving a bad taste on Obamacare, the
And
market
it's
is
a
speaking.
difficult argument to say, well, that 17% spike, compare that to what it would have been if Obamacare wasn't in place, because that's a number that nobody knows.
That's right. There's one other point ought to be made, and that is Medicaid. A lot of this is the Medicaid. People have been put on Medicaid. For New York State people, for citizens, this is a real problem, because initially the Medicaid increase as a result of Obamacare was picked up by the federal government. It will not be in the future, which means local taxpayers will pay for it because local governments pick up Medicaid as well as the state. It's a real issue that has to be looked at.
And that was the argument that led as many Republican governors as they did to not accept the Medicaid expansion, because they said at some point those bills are going to come back to us.
At some point, but I would say in New York, we successfully got a lot of people enrolled in Medicaid. That is true. Moving toward a Medicaid managed care model, which is less expensive, and ultimately the state should pick up the full share of Medicaid and not let the localities do it. It should be a state obligation, and hopefully we move closer to that.
So, Scott, give me the stump speech line that Republicans should be using in their campaigns to either oppose or call for changes in Obamacare.
Obamacare is unaffordable on a number of levels. For people it was intended to help, and it's unaffordable for taxpayers, and it's not working the way it should. But we need to do something to improve health care for people who don't have insurance. Let's design a system. By the way, it's one of the things they say, but it gets very complicated when they say, all right, well, how are you going to do that? I mean,
And don't forget, add on to that Republican line that Hillary's in bed with Obama in terms of supporting this, and that's another reason why they shouldn't support the Democratic ticket.
And worse, she's moved to the left,
Yes.
Bernie Sanders, to make
Yes.
this, a
Yes.
universal health care, which
Good
is
thing you're
another.
not the Republican.
And
Great thing.
And yet, pretty much the universal line from Republicans is how it's the worst thing ever and how it needs to be just gotten rid of. That seems to be a much more nuanced approach. I wonder if Republican voters would warm to that approach, or if they're so inured to people just trashing it and trashing Obama.
And those
for it.
Republicans who now have insurance think it's probably the way to go.
All right, we'll move from healthcare to another flashpoint topic, Gitmo. Our base at Guantanamo Bay is emptying out, but will the president make good on his promise to actually shut it down?